Welcome to learning about high blood pressure because your health is worth working for. I'm Jeanne Schumacher, founder of Plant-Based Academy and co-founder of the Pregnancy Advantage. And with me tonight is Dr. Christina Miller, currently practicing at Love.Life, and you can connect with her there at Love.Life. And tonight we are discussing what is hypertension, systolic and diastolic, what are those things, and how does it happen? And once you're diagnosed, what are some of your options? And we may get to some other questions, but that's what we're going for tonight. So what we discuss is for educational purposes only. Always seek the advice of your physician before undertaking a new healthcare regime.
And importantly, always work with your doctor, especially if you're on medications for diabetes or high blood pressure, as it will need to be monitored and perhaps changed. Learn from us, but also do your own research, dive deeper, learn more.
Yeah, because you only get one body and there's no do-overs. So, all right, let's just jump right in. Chris, let's start with the basics. What is hypertension?
Hypertension is the technical term for high blood pressure, and what that means is the systolic versus the diastolic, the top versus the bottom number. So when your heart pumps, it has 4 chambers, 2 top chambers, those are your atria, and 2 bottom chambers, those are your ventricles. The top chamber pumps the blood from the atria into the ventricles. The ventricles are big and muscular, and they squeeze it either out to the pulmonary, the lungs, or out the left side squeezes it to the whole body. And when they squeeze it out, it goes against the blood vessels, which have resistance, and they can be pliable or they can be stiff. You want to choose pliable if you're given that option. So as they start to stiffen or thicken or get diseased, the blood pressure goes up. And so that's called high blood pressure. And that is measured by taking a blood pressure cuff and measuring your blood pressure. The systolic is the top number. That is the squeeze of the bottom ventricles against those blood vessels as it's going up. And it depends on how stiff or compliant the vasculature is. The lower number is the diastolic blood pressure. And that's how compliant and loose the actual heart is, when the heart itself can get stiff and then it doesn't relax to allow blood to fill it back in to pump it out. And that's the diastolic pressure, when the heart is actually relaxing. So that's also an important number. And so anything under 120/80 is considered healthy, great, normal, wonderful. Anything between 120 and 129 systolic is considered elevated blood pressure. And hypertension is diagnosed at 140/150 is stage 1. Over 150 to 180, I believe, is stage 2. And then over 180 is considered a hypertensive emergency. And if it is that high, or even if it's not quite that high, but you're feeling symptomatic, chest pain, shortness of breath, headache, visual changes, any symptoms at all, please seek a doctor immediately. That is an emergency and you need to get that down.
And so many people don't understand or realize what is hypertension, because they do call it the silent killer for sure. So, all right, let's talk about that initial diagnosis. You go to the doctors, and probably for maybe a couple of visits, you've had elevated blood pressure. Once you're diagnosed, what should someone do? And what are going to be some of my options?
So to get diagnosed, you really want to have at least 3 reads that are elevated, greater than 120/80, basically. And so get your read at the doctor's office, but I also recommend checking it at home or running into a pharmacy or a grocery store, right? Sit down, take a few breaths, be in a calm state, and then check your blood pressure and see what's going on with that. And then write them down. And if it is truly elevated more than once, or if it's greatly elevated, you do want to address that. So there's a lot of reasons for high blood pressure. Your doctor should work with you to make sure there's nothing serious going on, right? So it's always serious, but things like it could be due to stiffening of the vessels. Like I said, atherosclerosis, that's the #1 most common reason for blood pressure. But it also can be due to kidney disease. It can be due to thyroid disease. It can be due to what are some of the other causes of it. It can be due to an aorta, a vasculature issue of the aorta. So there are other reasons for high blood pressure. So working with your doctor is going to be important to make sure that it's atherosclerosis, primary hypertension, we call it. And then after that, get your options. So blood pressure responds really well to diet and lifestyle changes, and eating more plants. The more plants you can get in you, the better blood pressure tends to be. So that is really important to start looking into something like significant diet changes, I like to call them. And lifestyle plays a role. So stress management and getting sleep and exercising, all of these play a role too. So as we start talking about lifestyle, which we will do more in different days, but they play a significant role to blood pressure actually. So learning what you can do to start getting that under control is super important. But I would say if your blood pressure is higher than 140/90 consistently, you probably want to get on something quickly, because the higher blood pressure actually can damage your body. The blood vessels can actually get permanently stiffened, or your kidneys can get damaged. So if it's persistently high, you may need to initially talk to your doctor about something a little more aggressive while you're doing the lifestyle changes too. So
I think hypertension, we do need to understand that it's your body telling you there's something wrong, that this is a symptom, and there's a lot of different reasons why you could have hypertension, as Dr. Miller said, but definitely you need to be under supervision, because they don't call it the silent killer for nothing. We definitely want to get it under control, and in many cases you can reverse it with, as Dr. Miller says, aggressive lifestyle changes. So, and that includes, monitoring what goes in and on, and then of course exercising. So some of the basic lifestyle tenets. Well, let's talk about that initial diagnosis. Once you get that initial diagnosis, you are going to want to keep track of your blood pressure and to be able to discuss this with your doctor. So is there a meter that you recommend, for home measurement? Is one better than another? Like they have the ones for the wrist versus your arm. What do we got?
You don't have to have a home one, but I do recommend it if you can. If you can't, you can always, like I said, check it at a pharmacy. They all have free blood pressure cuffs, or a grocery store, a place like that, or even go to your doctor's office and just get a blood pressure read. So it's always good to check it. But yeah, it's nice to have them at home. So there's a lot of different kinds and brands that are good. Right now it's better to get them on your arm. So that is a better way to get it, meaning it's a little more accurate. But that being said, data is definitely evolving. So, now the readables, people with their smartwatches or their Oura rings, there's so many ways that they're getting blood pressures, and they are becoming more and more accurate. At this time, I still trust the blood pressure cuff around your arm as the number one go-to, but there are more means, and I am following it to see as they become more accurate. The ones on your wrist are a little bit less accurate right now, and then they have a forehead one and an ear one. Those are a little less accurate. Let's see. Yeah, so some of the readables are good. There's a lot of good brands out there. Omri is one of them. Oxaline is a brand, Welch Allen, but there's a lot of different ones. What I do recommend is whatever you choose, whether you get it at your local pharmacy or you pick something, is take it with you when you go to your doctor's office, get it from your doctor, and then check your own. And then you'll kind of make sure it's accurate.
Well, I've seen some of those apps on the cell phone that say they measure blood pressure. And what I'm finding is anytime I've gone to one of them, it's oh, you just put your finger over the light, or you just do whatever. It puts it over your wrist at one point for another app. But what I find is it measures your pulse, and they show on there, they want you to buy the app. So it just shows that it does blood pressure, but in reality, what they want is for you to log in your blood pressure that you've taken with another, device. So they're trying to trick you. So I just wanted to share that with you because every time I've gone in to buy one of those, or to get it, or to download it, then it doesn't measure your blood pressure, because I would love to find something else that is an alternative than, to the blood pressure cuff that you have to carry around the machine and this and it's on your cell phone. It'd be great. But I have yet to find one. So if you find one, let me know.
Yeah.
I would love to find one for my cell phone. In measuring your blood pressure at home, you have an arm monitor. What is the best way to do that?
So yeah, your blood pressure responds to what's going on, right? So if you're running around and you're stressed out, it's going to go up, and it has to do that because it's got to pump blood to your body, right? So as you exert yourself while you're exercising, it's going to go up because you're exercising. It's got to pump more blood. When you go from sitting to standing, it may change a little bit. Sometimes it goes down if you're not pumping blood up out of your legs well enough, or it goes up as you stand. So it kind of, we expect to see changes. So when you're getting a blood pressure, the way I recommend doing it is sitting down, getting comfortable, taking a minute to take a breath or two, just kind of ground yourself, quiet yourself. And before you just sit there and take it, you don't want to be checking a cell phone while you're taking it. You don't want to be talking while you're checking it. It seems like at the doctor's office, they're always like asking you something and checking your blood pressure at the same time. And that's not right, because actually just talking raises blood pressure. So you want to kind of sit and calm yourself. I like to take a deep breath or two. I don't take too long. Some people say give it 2 minutes before you check it. I personally don't wait that long, but I do like to get a second to kind of quiet person. And then you check your blood pressure, see what it is, and you get your read. And I do have people usually, then I have you take a couple slow, deep breaths, long exhales, really tap into the vagal nerve, which can actually lower your blood pressure quite a bit, and do that for maybe a minute, which is not very long, and then recheck it again. And it almost always will come down at that point. And I go with that second one, but it's kind of nice to have an average or know where you are and see what's going on. It's also good to check it different times of the day. Not that we should be obsessed. No one needs to be checking it all the time or obsessed, because we can get anxious over that, and that is not going to help anybody. But, maybe today I check it in the morning, maybe tomorrow I'm going to check it later in the day, just to make sure it's not, it means different things if it's high in the morning or high at night, or, whatever's going on. So kind of have an idea, but I also don't want people obsessing over it, because I know I can do that too, where I get so anxious, I'm checking it like 30 times a day, and that's not helping it go down, certainly.
Because some people do have that, tension when they start to, oh my God, I'm going to take my blood pressure, and you just get this tension.
I've done that. Yeah. And it goes up. And so it doesn't help anybody. So I want to make sure nobody else makes that same mistake. And if you guys are doing it, it's not helping us. So we want to calm ourselves down. And
I've heard people share that they take their blood pressure 3 times in a row and repeat the procedure back to back. Is that okay to do that?
Mm-hmm. It's okay. Yeah. And like I said, I do it at least twice, sometimes 3. You'll see it come down as you relax, as you sit, as you can bring some vagal tone into it. It actually will come down. It can come down by 20 points from the initial one. So that's quite a bit. And so that now I know what it is when I'm running around, and I know what it is when I sit there calmly. So yeah, it's worth checking it a couple times.
Well, let's talk about that initial diagnosis and keeping your blood pressure under control. So you had mentioned that, once you're diagnosed, the treatment may initially include taking prescription medications. I mean, of course, the ultimate goal is to get to the root cause of whatever is causing the high blood pressure through, diet and lifestyle changes. And you may need to, until you can get that under control, you may need to take a medication. So how important, first of all, is it to keep your high blood pressure under control? I know you had some personal experience in this, especially you were on medication for a while. Share what happened when you didn't keep it under control with medication.
Yeah. So for me, I have kidney disease. So that's why my blood pressure went up, and it shot up fast. And people with kidney disease, it's really hard to bring that down. Actually, it's not like the other blood pressure. So those are the people that often need 3 medications and it's still high. So it's very hard to get that down. And so mine shot up too. And it was very sensitive to stress or my thoughts, right? It was very sensitive to what was going on. And so, work comes and pressure and this and that, and there went my blood pressure, right? And so it's my job to step back and say, whoa, I can't handle that. So I had to address my lifestyle factors and prioritize that and step away from these stressful moments. And so that makes a big deal. That's why I talk a lot about breath work. Breathe slow, deep breaths, that long exhale. So if you breathe in for 3, you breathe out for 6. If you breathe out for the count of 4, you breathe out, or if you breathe in for the count of 4, you breathe out for the count of 8. So you double how long, where did that go? you double how long you exhale from how long you inhale. That's what taps into your vagal nerve. That's what lowers it so dramatically. And what I learned about myself is that I am not in vagal tone, and I run around in sympathetic, go, 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 go. And so maybe high blood pressure was a blessing, because now I ground myself throughout the day. Now I'm like, okay, settle down. Like, you need to quiet yourself, tap into that vagal nerve, calm everything down. And so that's the deep breathing, really powerful.
Well, did you have any issues? Like, I believe you mentioned at one point that you had medication, but you went off of it.
I was on medications, but as I improved. So, with blood pressure, like with any other, like you said, it's a symptom of something. So for me, it was a symptom of my active lupus and kidney disease. So I worked on, improving that. So as I got that under control, then I was able to get my blood pressure, but I had to do the lifestyle. My blood pressure did not come down. I'm telling you, it's so resistant until I did the mind body work. Then it finally started to make a difference. But I did everything, you guys. So if people want to know all these tricks, I feel like I know so many of them, but I'll name a few of them today. I did meditation. I did coloring books. I did hot tubs. I use a sauna. I exercise both a little bit and hard. And if you have high blood pressure, make sure you clear it with your doctor that you can't exercise, that it's safe for you. So I did that. I did, talk to Jeanne, who's the expert on chemicals and cleaning our environment out. So, I made an effort to clean my life up a little bit. I bought some toys, some tools to help me with breath and calming my breath down and things like that too. So we've talked a little bit about some of the apps and some of the tools we've used. So I used all of those apps. I did mindfulness work, and I have apps for meditation and mindfulness and visualization, things like that. So, but really it works, to be honest. So it seems like a lot, but I was a basket case, and that's what I needed. And so it really helped me, and it still does. I still do all those things. I mean, in different phases, but getting out in nature, saying I can't start till a little bit later. I have to stop a little bit early because I got to spend time in nature to calm my blood pressure down. So, and it really works. Now I'm not on those meds and my blood pressure is under control, but it can easily spiral out of control if I don't take care of myself.
It's true. It's true, because your health is worth working for. Well, Dr. Miller, we have one question so far, and that will wrap up this session for tonight. So Shirley, thank you for joining us. Shirley asks, can arthritis and fibromyalgia be the cause of high blood pressure?
That's a really good question. So it can certainly contribute, because fibromyalgia and arthritis can be both inflammatory. So I don't know what kind of arthritis, but even osteoarthritis is inflammatory locally. And so inflammation raises blood pressure. Yes, absolutely. So you would want to make sure you're on really optimizing your anti-inflammatory diet and lifestyle. And as you get those under control, also gut issues, microbiome imbalances, that absolutely affects blood pressure. And so as you get that under control and your symptoms quiet down, everything feels good, that's when the blood pressure starts to respond.
And I just want to point that out, like the arthritis, I mean, these inflammation issues calm down as well.
Mm-hmm. Right. No, exactly. And sometimes that's what motivates us. That's what first motivated me, but the blood pressure certainly, that wasn't fun. But yeah, no, the joint pains get better. Mm-hmm.
Absolutely. And I've seen it with myself. I know you have, and so many other people that we connect with. We know that you can heal your body once you stop hurting it, and you get to the root cause of what is causing the issues, what is causing your fibromyalgia, what is causing your arthritis. It's inflammation. Okay, well, what is causing that inflammation? You've got to get to that root cause. And as Dr. Miller says, it's, your gut biome is a huge one. And we have destroyed a lot of our gut biomes. And that's a really important piece. So, Dr. Miller, always a pleasure connecting with you.
Yeah, thank you.